All right. Hello, everyone, and welcome to our third Meaningful Change session. My name is Danielle Hayward, and I am the Interim Executive Director of the Cute Syndrome Foundation. And we're so excited to have everyone here this evening. First, I just want to thank our sponsors, Neurocrine Biosciences and Praxis Precision Medicines, for sponsoring our Meaningful Change series. Without them, we wouldn't necessarily be able to bring these amazing programs to our families, so we're always very grateful. I do want to point out, as you just heard, this webinar is being recorded and it will be shared on our YouTube and our website. So just be mindful as you're talking out loud that the webinar is being recorded. Please note that questions and comments are welcome in the chat throughout the webinar. We do just ask that you refrain from asking specific medical questions because we are not able to provide medical advice on these webinars. So as far as tonight's session, something that we hear often is that caregivers feel unheard and face challenges establishing a true relationship with their medical providers. We believe in fostering better understanding between patients, caregivers, and providers leads to better outcomes. So tonight we have Heather Bentley with us, who is from Write for Rare. And Heather has been a supporter of the SCN 8A community for a long time. And she really believes in breaking down those barriers between professionals and patients and caregivers. So tonight, Heather is going to lead us through a conversation about creating a positive relationship and establishing a positive relationship between patients, caregivers, and providers. And I'm going to turn it over to Heather to get that conversation started.
Thank you so much, Danielle. Yeah, this is an absolute pleasure to have this conversation. I think, as you say, we hear there are a lot of stories in the rare disease world that repeat, that are sort of refrains. And one of them is, my doctor doesn't listen to me. Um, I try to explain, but they don't seem to understand. And so we want to take a look at that narrative, right? At that story and kind of break the frame a little bit or a lot bit. And so today we have Marcy and Xuan Hoang with us, and their relatively new neurologist, Nicole Cobo. So this is a conversation as it happens from a family who is navigating a transition of care and is setting up a new relationship with their clinician. So we're not trying to say this is how you should do it, be like this or don't be like that, but we want to have a conversation that is real from the lived experience, and talk about what each party needs. We want to take a little bit wider view of rare and expand it from families, caregivers, and patients to all the people who really live here, and that includes our providers as well. So we do just a quick intro and a question for you, Danielle. I'm seeing
Yeah.
tiles, so I'm not seeing the slide in full presentation.
And I am trying to fix that right
Mhm.
now. I
Okay.
appreciate everyone being patient
Okay.
with me as I learn apparently the hardest part of my new job is Zoom.
Yeah,
So.
tech, ever, always. Well, Marcy and Swan, seen here in Hawaii, but actually just a little to my south in Chula Vista in San Diego. I'm also in San Diego. And we met in Los Angeles at the TCSF meeting. Um, and of course we're from San Diego, so we have that in common. But what really sealed the deal was that I think, Marcy, you were wearing a band T-shirt of a band called The Who. It's the HU, and they're a Mongolian heavy metal band. Now, I don't expect anybody else to know about Mongolian heavy metal bands that I might have just seen live right before we met them. So it was like a sign that said, right here, go talk to these people. Marcy loves cats. Marcy's from New York. Marcy's been Swan's mom for the last 20 years as well. Marcy loves cats so much, you're probably going to see one at some point today. We might get a little visit there from Sketch. And Swan is one of the funniest people I know. She is always cracking jokes. We said, SCNA warrior, does that work for you? Can we put that on the side? Do you want princess? What do you want? We're like princess, and she said, no, warrior princess. So to be clear, here she is. Xuan also has SCN8A and missense variant, gain of function. She's been seizing since she was 2 months old. Um, so we're not going to go through the diagnostic odyssey. Every family has a version of it. We kind of assume that you all have a lot of things in common. We've been down these roads. So that's those lovely ladies. And then we have Nicole Cobo. Dr. Cobo is a board certified neurologist and electrophysiologist. So Eve is in the house. Um, and she is, as you know, she is watching the World Cup. She's also a mom, has a couple of kiddos, and spends her free time momming. Um, and she's also a board certified physician who did her MD work at Stritch School of Medicine in Loyola University at Chicago, and her fellowships and residency in Los Angeles, where she has been practicing in private practice ever since and has developed quite a DEE practice. So lots of DEE kiddos. So Xuan is not her only SCN8A kiddo, which is unusual. So welcome everybody. That's a little bit about how we got here. Hey, Tammy. We were going to start out. I was just going to ask Marcy to talk a little bit about, we're going to talk about kind of what the need was like when she was looking for a new physician for Xuan at that transition point. 18, 19, looking for a new physician and what she wanted from that relationship and kind of how it went. Then we're going to get up to the visit. We'll talk about also leading up to the visit, we'll hear from Nicole about, what it's like for a physician looking at the day coming into a new relationship. And we'll talk about how it went and how it's going, and just the real nuts and bolts. And then we'll open it up and have a conversation. So that is the day. All right, with that, I think we can go to presenter views. And Marcy, I'm going to open it up to you just to kind of talk a little bit about, when Xuan she's in her late teens, she's transitioning, and what you were looking for, and kind of how you went about your search and what happened.
Yeah. So when I knew she was turning 18, I will say the first thing I did, which is a smart thing for everyone to do, is get conservatorship so that I didn't have that I didn't have to worry about that at all. That was the first thing I did. And then we are members here of the Epilepsy Foundation. So they actually had a conference about transitioning into adulthood. And so I went, and there was a panel of doctors there. I listened to what they had to say. There was one I really liked. So when the time came, I said, let's see if we can get into that doctor. And there was a lot of hoops, jumping through insurance, and then with the actual medical facility, they had their own hoops to jump through. Once we did all that, I mean, that was anxiety provoking enough. But once we did all that, we went to go meet this doctor. And to put it bluntly, it just was not a good fit. It just wasn't a good fit. I was looking for somebody who would have maybe done a little bit of research on SCN8A before I got there. Who I don't know. There was just some things it was clear to me she fits the mold of SCN8A. I didn't see the need to reinvent the wheel and put her through all this testing she's been through multiple times. That's just torture for her. Why would she need to do that? And there were some other things, dynamics with the doctor. It just wasn't a good fit. During the whole appointment, I kept my mouth shut. I was very civil the whole bit. And I just went home because I said, I was anxious. I was nervous. Let's just think about this before I make any changes. And after about a week, 2 weeks, I was like, yeah, no, I think I'm not going to hang it up with this person, but I'm going to keep looking and see if there's somebody else out there who I feel more comfortable with. And so that was the process. And to be honest, we also like to go to the epilepsy conference up in Disney here in California.
Mm-hmm.
So
Yeah.
I went there and did what I normally do, go around the tables and start talking to people and stuff. And I saw this one table and it said, um, peds to adulthood. And I was like, wait, I've never seen that's unique. I've never seen a doctor's office that
Mm,
does peds and adults. It said women's,
mm,
peds, and adult. And I was like, well, shoot, is there anything like that? Because that would have been perfect for us, but obviously it's too late. So I
yeah.
started talking to one of the reps at the table, and the next thing you know, I was talking to Dr. Cobo, and I was like, well, shoot, we may be 2 hours away, but let's give this one a try. So
Mm,
that's it. It was, to be honest, I was looking, so I knew I was, but it was
mm.
a fluke that I ran
Yeah.
into Dr. Cobo. Yeah.
Reframe that as not a fluke. Uh,
Well, it was,
you knew where to go to find people, and
yeah,
you were very courageous not to settle and just hang in there. Because you
yes.
did, as I remember, you had some needs for Swan's medication. You had some real needs of goals of care that
Well,
needed
yeah,
attention.
yeah. When we left Peds, we were trying to wean her off a medication,
Yeah.
and when Peds suddenly said, we're discharging you from Peds, you need to find an adult doctor. And I'm telling you, on the Peds side, there was no advice, nothing. They just said, well, we'll keep prescribing her meds until you find a doctor, but that should be in about 6 months. That did not happen. It took over 9 months, and we're stuck on not we continuing the wean because I didn't feel like I had anyone in our arsenal if anything went wrong. So I was like,
Yeah.
what am I supposed to do? And there was
Right.
some other things too. Like I know there was a study we wanted to enter, but I didn't feel safe entering any study or dealing with this without a doctor I had in my arsenal. And honestly, the doctor I had already seen, I didn't feel like he was a good one to help me navigate this and help
Mm,
give me what the word I'm looking for, to make decisions, give me the right information I
mhm,
needed to make an informed decision.
mhm.
We don't
Perfect.
always necessarily make the right decisions, but you need to feel like you have the right information, some information, so you can at least make a decision.
You need a
And I
partner.
didn't feel like I had that with the other doctor. And so
Okay.
we were stuck in limbo for about a year.
Thanks,
And
Marcy. I mean, I asked that question to reframe it because it wasn't trivial. It's not like you had all the time in the world. Really needed some things for Swan. And so that relationship matters. And the courage to say, you know what, this isn't going to work. It's not going to cut it. We're going
yeah,
to keep looking and we're going to look far and wide.
yeah. And
Um,
and I
and
would say,
so not an accident, not a fluke.
yeah, but yeah, if I hadn't have gone though, I wouldn't have met
Yeah,
Dr. Kovo. And it just so
right.
happened that she happened to be there at that time. So I still look at it as, a
Yeah,
lucky
yeah.
thing. And yeah, I mean,
Well,
the other thing too to navigate was the medications. I have to say that the PEDS office got in touch with me after 6 months and said, we're not going to continue to prescribe. You need to find another doctor. And I'm like,
yeah,
I'm trying.
yeah.
We didn't even have the first doctor yet. We're still trying to navigate the other facility just to get us in there and get the appointment. And then when they made the appointment, we had another 3 months. And I'm like, you got to keep prescribing the meds
All
because
right.
so that was another difficulty.
Thank you. So I think that's it. I wanted to set the scene appropriately. Like there were high needs. One attempt, you did your research, you did everything you should do, didn't work out, and you kept going. Okay, so then you met Nicole. Actually, Nicole, we'll say Nicole here, Dr. Cobo, when you're in the office. Um, what was your take on, what do you see when you're standing at the epilepsy table at Disneyland? First of all, thanks for being out there. But I'd love to hear your perspective on people coming to you like that.
Yeah, yeah. I mean, it's one of my favorite days. I think it's always nice to see people talking about epilepsy in all forms. I feel like so many people still suffer in silence or ashamed by their diagnosis, feel isolated, and so anything I can do, events like today to raise awareness and empower parents and caregivers, because I really think that's where the change is going to start. I'm happy to participate. Um, I most families going to those types of advocacy events are usually the families that are very well informed and have a good level of support and have probably heard about those types of events from their epilepsy community or hopefully even from their actual physicians. But I think raising awareness for other families who are either new in epilepsy or maybe who have decades in epilepsy and are, maybe haven't heard of some of the late breaking and new and exciting things that we have available, really should be going to those events. And I think Marcy and Xuan's visit during that period of transition was fortuitous. I do have a unique position in private practice and that I don't have to graduate my patients. Many children's hospitals are licensed only up to age 21 unless they have associated adult hospitals. And so even though many pediatric epileptologists are comfortable following their patients because the primary diagnosis is one of pediatrics, they're forced just by their institutions to graduate their patients. There has been a wealth of talk and research and even whole conferences dedicated to transition of care from pediatrics to adults across all subspecialists, and we're not doing it well. As a medical community, we are not doing it well. And so
Yeah.
the burden does fall on the caregivers.
Yeah. So, I mean, transition of care, we could do sessions on that, right? This just happens to be the point where Marcy and Xuan are at to start this new relationship. Absolutely, that transition of care, fraught, such a fraught. And I actually didn't know that. I didn't know the that it was an institutional requirement. And those are the kinds of things that actually personally I'm really interested in, right? Those are decisions that somebody makes in a system, and I'm interested in understanding what those levers are that push on physicians as well as families, right? And then put us in these odd positions. Okay, so we're coming up to the visit, and I have a unique perspective on this particular visit because I went to the first visit. It was in February with Marcy and Xuan and their nurse Beth as well. So we went as a posse. We rolled up into Long Beach. We're not having another one of these. We're all there. I put away my jangling spurs pretty quick. Was not needed. Um, but Marcy, do you want to talk about just kind of getting up to the visit and getting into the room? It was a fraught day. I mean, I came from LA, you came from San Diego. We meet in Long Beach. Stuff wasn't going so smoothly.
Yeah, that was an insurance issue. So unfortunately, Swan is under her father's insurance. And I was pretty sure I had a copy of the referral that went through in December. And for some reason, their offices couldn't find it. And when I ended up having to call her father, and he was of no help. So I finally, to be honest, he's like, oh, it went. So I ended up calling insurance and they finally found it. But I had to literally tell them it went through in December. And I said, did you guys even send it to their office? You were supposed to. So I said, you need to send it again now. And so that was just hard navigating that part because I was like, well, forget this. We're doing the appointment and I'm paying out of pocket if we have to because we're already here. But I was a
So you
little
started
annoyed.
with some healthcare
Yeah.
hurdles, right? I'm going to put those in
It
the
was an
healthcare
insurance
button.
hurdle. So
Mm-hmm.
and you're expecting to you put your little list together of what you want to discuss with the doctor, and you're not expecting that to be a part of it. I'll
Yeah.
say. Yeah, so it kind of, discombobulated me a little bit in the beginning.
Yep. Yep. And so, there's a lot riding on it. You guys would also making a weekend of it. You're planning to go out to Catalina from there. And so, it kind of it needs to go well, right? There's a lot of high expectations. So that's what you get, Nicole. That's what's on your schedule for the day as you wake up in the morning. I mean, how do you what is your day like? We kind of know where they're coming from and a little bit where I'm coming from. Where are you coming from into the clinic that day?
Yeah, I think it's a very thought-provoking question, Heather, but I think one of the messages that I would love to share with, the caregiver community is it all comes down to time. When I look at my schedule, I have specific blocks of time, whether it's a new patient that I'm meeting for the first time or whether it's a follow-up patient. But most of us, and I have a little bit more flexibility in private practice than I would if I was still with an academic institution. But we don't necessarily get to say, oh, I'm meeting a 20-year-old with a 18-year history of epilepsy. I'm going to need a little bit more time for Xuan than I would if I was meeting somebody with new onset seizures that just started a month ago. We don't get to make those calls in our schedule. And so I think so much of the valid concerns from families is that they're not able to share everything they want to share. That all of the details didn't come to light, all of the different factors weren't discussed. And ultimately, it does just come down to time.
Hmm.
I wanted to share, I think it's
Hmm.
important that families understand, most of us are taking insurance. Insurance, I even looked this up in preparation. Insurance at the highest level, complicated new patient visit gives physicians upwards of 60 to 74 minutes for the entire visit. And that includes any prep work of reviewing outside records, the time we have with family and examining our patients, and all of the documentation and the notes and any sort of outside referrals, pharmacy interface. All of that is supposed to happen in no more than 74 minutes. And I think we all know, and working with your caregiver, that there can be follow-up visits that last 74 minutes, let alone a new patient appointment where I have 18 years of catching up that I want to get to know Xuan, and there's just no way it's all going to happen in that time frame.
So what do you do? How do you address that challenge?
Yeah, yeah. Um, the art of my medicine and what again has evolved in
Yes,
the years of
yes.
doing this is I try to let the caregiver or the patient, dependent upon who wants to drive the conversation, speak up first. I don't assume, when I walk in a room that, we're here to treat seizures or, fill in the blank,
Mm,
kind of
mm,
second opinion epilepsy consult. I try to start with a sentence of what are your goals for today's visit? And let that drive the information that I want to at least prioritize. And then I have a practice of trying to see my patients back, particularly when I'm getting to know someone, see them back in short succession rather than trying to get everything I need to know all in that first visit.
mhm. Awesome. And gosh, I'm taking it in, right? I think it's so fascinating to understand also the pressures on physicians and what it, when you said 70, 60 to 74 minutes, I thought how could we even respond to that? Like it's so patently inadequate.
It is.
Um, so we'll take that conversation. So thank you for that. And that is exactly what I meant. Like you're coming into the visit, you're looking at your day and what's in your mind, right? How am I gonna make this adequate? How am I gonna take and have that be a sense of care and not let the healthcare requirements get in the way. So we arrived. We arrived at the visit, all of us. And in that room that day was Marcy and Xuan and Beth, Xuan's nurse, and me and Nicole and your PA, Jasmine, I think her name was. So it was a crowded little exam room. But a very supportive, and just almost as I see on the screen, a very supportive circle of women, as it happened to be. Um, and so we kicked off, and that was one of the things, right? For me, in my role as muscle, um, when you opened with the question to Marcy about her goals, I, as an advocate, went, okay, all right, okay, that's good. That's a good start. That's a good start. I like this. And Marcy, you already talked a little bit about what you were working on there with Xuan. But you want to talk a little bit about kind of coming in, what you were looking for in a physician, and let's talk about how that visit went. It's a little odd as well, right? I don't know if it is odd. I don't know if other parents do this. But you may talk about bringing a posse to a visit.
Yeah, well, to be honest, when I've brought someone to other appointments, I usually have a nurse in tow. And I think for me, it's good to have at least one other person because when we're done, we go home, I say, this is what I heard. Did you hear the same thing? And I've been told before, it's like, no, I don't believe that was what was said. This was what was said. So I love to have another person just because I need to double check that what I heard was really what I heard. So I think that's important. I usually like to bring a nurse too, especially because the nurses are involved in their care. And if there's something the doctor said, they need to hear it as well, not always coming straight from me. But so I wasn't, the posse was, yeah, it gives me just some backup and makes me feel better. Also, if Xuan can't handle certain things during an appointment, it's always good to have another person so that she can be removed for a couple of seconds and reset. And yet I can still concentrate on getting the information done and not, wasting time. Well, she has to go to the bathroom. I'm sorry. Well, she's getting too hot or this or that. It
And
helps.
that happens. Yeah, that happens that day. Yeah.
She can't always sit for a whole appointment.
Yeah.
But we still have things we have to get done within a time limit.
Mm-hmm.
So there's that. I would say I think it was helpful to immediately go into what are your goals and discuss the goals.
Yeah.
I think it helped frame the whole appointment.
Mm-hmm.
And
Mm-hmm.
it made me feel like, oh, okay, here's somebody who's willing to listen to me and wants to know what's going on. Not,
Mm-hmm.
And yeah, no, I mean, personally, partway through the appointment, I was much more at ease, felt safer to talk, felt heard. I mean, and that's the thing is you want to have a safe space to say everything you're thinking, all your fears, the whole bit. You don't want to be told, oh, you're crazy that you're thinking that or blah, blah, blah. No, you want to be heard. And that's important because otherwise you don't tell the doctors everything. You just don't because you don't want to be judged, I would say.
Yeah. Yeah. I want to come back to that. I think that's really important and something that we don't talk about as much. Do you mind if I share a little anecdote from that day about kind of when it was, at least it was clear to me that you were going to have an ally in Dr. Cobo, and that is um, we were talking about medications and we were talking about risk of SUDEP and medications that particularly from Tepla. So we're talking about SUDEP and um, you know, Marcy, you leaned in a whisper to Dr. Cobo. And I remember it, and you said, because you were hugging your son, and you said, that's why I sleep with her. That's why I sleep with Swan. And it was like a confession. And Nicole, you heard that confession, and you leaned in, and you said, and that's why I would recommend you continue to do that. And in Marcy, I could see relief, right? That sense for a moment that like this life, this balance that you've struck, Marcy, that you've made, it's okay. And it really it was a really touching moment. Nicole, those are tough conversations. How do you handle that with families? It's one of those things I still hear families say, our doctors never talk to us about it.
Mm-hmm. Mm-hmm.
But who wants to talk about it? Like it's one of those.
Yeah. I think it's like anything, knowledge is power. And, none of us ever want to be in that position. I don't want to lose a patient to SUDEP, and parents surely don't want to lose their children, their child to SUDEP. I will credit our professional body, the American Epilepsy Society, has consistently, in the last at least 3 years to my recollection, made a very big stance on educating us practitioners about SUDEP education and the risks and the mitigating factors and how we can cancel families. And so I think, and I hope us practitioners in the epilepsy field are more empowered with that knowledge. And with that knowledge, we can share with families so that they feel more empowered too, again, all we can do is reduce the risk. And there's a lot of things and many layers that we can put in place to reduce that risk. But one of those is co-sleeping. And I do hear it from many families that I don't know if it's our American culture, that frowns upon that, but it does seem like it's almost an unspoken thing. And the literature is very clear that that actually has clear protection against SUDEP. And so that is one of those factors that when Marcy shared, I could easily validate that decision.
Mhm. Mhm. And so on that subject of validation and judgment, I think that's a good one to spend a little bit of time on because, as you have been working on changing meds and getting a new regimen, right? And that comes with it's a balancing act, right? Nothing is 100% one way and changing, I remember Marcy going into the change of providers, you were worried about rocking that boat. But I remember you told me about I want Xuan to live till she's 40 and beyond. And so we can do better than this. But you knew that it was going to be rocky, right? You knew that means there's going to be potentially seizures and breakthroughs and you're gonna have to go through all that. But you and Dr. Cobo, you came up with a plan. Um, and where judgment comes in, I think, is as you've been negotiating what's more important, seizure, quality of life, you've been having those conversations about things you want to do in the world with Xuan. Um, and being able to talk those through with Dr. Cobo without worrying about her saying, well, you can't do that. You're kidding. You can't take Xuan to a rock concert with strobe lights. Are you nuts? Right? So we have a different conversation. Again, we're going to reframe that conversation. So can you talk about that, what that's like for you, Marcy, the difference that kind of, I think that's sort of an essence of care, right? You're working together to create the best life possible. So can you talk a little bit about how that works right now?
Ah, So yeah, I have to say that, how do I put it? Feeling validated and feeling like there's someone who has your back has definitely given me, I don't know if I'm saying the right words, but it sort of opened up the door for me a little bit to do more things with Xuan that I might not have done in the past. Like take her to that rock concert where I know there's those darn strobe lights and we could have a seizure and no one's going to yell at me like, what the hell did you do that for? It's her favorite band. She gets a chance to do a meet and greet. We're going to do it. She loves these people. And why am I going to keep her, why are we going to have cabin fever? Let's do this because I'm pretty sure I'm not going to get yelled at afterwards if we do have a severe seizure. And then, I mean, something that happened in this process that literally 2 months before we did it, I was just like, we've got a good window. Things are going good. We have a good team right now. I'm doing this. And at the last minute, I booked a trip to Alaska and I took her to Alaska. Boom. We haven't been anywhere. It's like the first trip I've taken with her since before 2018, before she had she had a severe seizure that caused her to have some changes. Since before that, we hadn't been anywhere. I mean, she was literally, I don't know, pretty much having 911 calls almost every month, or sometimes we got lucky and it was every other month. But I was like, we're risking it. I think she's doing well at the moment. Let's not wait to, wait and then the honeymoon period is over with and then we can't do it. Let's go now. And that discussion happened with Dr. Cobo before we did it. And it was really nice because we were a team. she worked on it with me to make,
Mhm.
to allow, instead of saying, I don't think you should do that. I don't think it's a good idea. That never even came up.
Mhm.
And I have been told in the past by some doctors, oh, I don't think that's a good idea. So it's not, that yeah. So
It's, I'm going to just let that stand there. Nicole, how do you work with families? You said earlier, like, I don't assume we're here for the seizures. So you talk about how you work with families to find that balance.
It's not just about the seizures, and I think that is that is not taught in medical school. That is a lived experience of being in medicine, that I wish we did a better job of teaching new and young physicians, because we get very good at understanding pathology and knowing what to do to fix it. But we lose sight of the whole person and the whole family in the process. I tell families all the time, I've done you no favors if I stop seizures, but I've left you with nothing but side effects or mental health concerns or,
Mm,
neurocognitive consequences.
mm,
So it is, we are here for quality of life, and
yeah.
unfortunately, and many times in the DE space, complete seizure control is just not a realistic goal. It's surely something that we are all fighting for, but we are looking for the balance, and that quality of life is the balance of sitting at home waiting for the next seizure versus going out and taking an incredible trip knowing yes, there might be a seizure, but hopefully we plan ahead and we have, a plan in place of what we can use to try to prevent it from, elevating to a medical emergency. But yes, it's not seizure control, it's quality of life.
And so I also, I just thank you. I think the difference that having care for Marcy, for the caregiver, right? That little bit of stress relief on the caregiver really opens the world for the whole family. Um, it's just amazing. Such good stuff. Well, in order to have this conversation, the other thing we wanted to make sure we did is give Xuan a voice. And so since she's here and she's with us today, I'll give you, hey, Xuan, Swanee, my girl, do you want to say anything to this group, my SCN today? They do know that you're a warrior princess, by the way. So, anything that you want to tell us about going to the doctor or doctors?
Well, I keep on not feeling the doctor's poke
Mm,
in the in my bed.
mm, straight up. I I heard that the doctor's poke.
yeah.
Is that what we said, Marcy? Did I get anything
Yeah,
else?
she's talking about she does not like all the poking, the blood
Yep,
tests.
yep.
Yeah,
We asked her yesterday, and we
Eh?
don't need to play the video. So,
yeah.
we were Marcy and I were kind of
It
prepping and going
was
over the
a strong girl, so I get through the blood test.
Yes, she was a strong girl, so she got through the blood test, but she does not like that.
so
She's a hard stick. They have to use ultrasound and stuff. She's a very hard stick.
right. So this is perfect. So thank you so much, Swan. Thanks for telling us and telling Dr. Cobo and your mom. So, when we talked about this a little bit yesterday too, Swan doesn't like tests. She doesn't like the testing. And so then, when we were just Marcy, I, and Swan, we were talking about, well, we still have to do tests. So Dr. Cobo, how do we take Swan's voice into account here in the relationship?
Yeah, I mean, Again, we have guidelines and recommendations on what we're supposed to be doing with, certain types of blood monitoring and checking the levels or the cadence of repeat EEGs, for instance. But all of that is up for discussion. There are times in which us physicians will feel more strongly based upon, the levels of concern or the past experience and research to say there are some medications that absolutely require blood monitoring. And then there are some in which the risk is relatively low that we're going to run into difficulty. And as long as it's a shared decision that we accept that risk, we will forego the blood draws. EEG is the same. There's some physicians that like to do regular checkups to make sure we're not missing anything. But if that is just really a negative experience for the child, which is understandable, then that should be discussed. And if a physician feels very strongly, they should be able to share why, not just that's my practice type of answer.
That's great. Yeah, I mean, and Marcy, you were already thinking about like, well, what is it that's one really, that is the most troublesome, and are there ways to prepare her or lessen that burden? And so, as long as we're having the conversation, right, we have options to try and make it better and try and hear Swanee about. Is there anything else, Swanee? Look like you might want to say something else. She's still chatting away over there.
Yeah, I was like, let me unmute. Is there
All
something
right,
else
you
you
got
have
anything
to
else
say?
for us, girl?
Yes. And keep always throw and down. Mm.
Mhm.
Well, I'm not sure what
Oof.
you're trying to say. Well, what are we trying to say?
Mhm.
Swanee? What?
My body gets weak. Mm, my legs are not walking.
You got it? Can you help us, Marcy?
I think she's letting everyone know that she recognizes that her body isn't the way she wants it to be.
Hmm.
And I think is
Did
what
you
she's
say
really
not
getting at.
walking?
Yeah, she
Is that
said
what she said?
my
Yeah.
body is weak and my legs are not walking. And I think she's just letting us know that she recognizes these things, even though she's obviously having a hard time communicating that
Yeah.
these are bothersome for her. And it's a part of the SC8A condition. And it's we work to try to give her a good quality of life, right? Yeah. Do we try to do well with you? Yeah.
I do.
You do get
Thank
paid.
you. Hey, Swanee, that was some serious warrior business right there. Thank you so
Really try to
much.
communicate that.
Yeah.
That was really like, and we can just talk about what 74 minutes. We need more time. We need to come on SCN8A time, right? So that's what these conversations are about. They're about reframing it to our lived experience, right? And sort of saying, wait a minute, 74 minutes, come on. Um, and my hope is that if we find enough of these things, that we can actually find things that we can move, boulders that we can get together and shove out the way. But we have to figure out what they are first. All right. So this hour is going very quickly. Um, I do want to just give everybody, give the panelists a chance. Thank you, Xuan. I want to give Marcy and Nicole a minute just to say anything that we didn't get to. We could have had a million questions, and then we'll open it up for just an open discussion with our folks on the line. Does that sound fair? Make sure everybody got a chance to say what's in their heart and on their minds, and then we can open it up. So, Nicole, would you like to? I know we had a lot of really great pre-conversations, and I'm going to turn it over to you just to kind of talk about caring for DEE families and
Mm-hmm,
what that looks
mm-hmm.
like for you.
Yeah, yeah. In our conversations, Heather, I think it struck me that it might help families, particularly in this potential transition period to an adult neurologist or epileptologist, to understand a little bit of how we are trained
Mm,
to, again, we're still advocate. I still promote you always advocate for your child, but I think if you understand a bit of how the physician approaches the situation, you will understand at least maybe some of their questions and recommendations. So within the world of DEE, this would be considered a refractory epilepsy, and adult neurologists in particular are very much approaching refractory epilepsy with the possibility of a surgical intervention. There's a wealth of data now, despite our many different seizure medications available, that suggests that after two medication trials, the chance that the third, fourth, fifth, sixth
mhm,
medication
mhm,
gets us that full seizure control is slim.
mhm,
And so I think many parents are potentially taken aback when they meet with an adult provider who wants to do the full surgical evaluation, the
mhm,
overnight EEG in the hospital, the MRI, the PET scan, extensive testing even beyond that. But I wanted families to be sure that they know, first of all, that epilepsy surgery is not just resective surgery anymore. We know that, with DEEs, that there's not a specific region of the brain that we can remove from a classic epilepsy surgery standpoint, but particularly not only with the VNS, which we've had for decades, but with the new RNS, responsive nerve stimulation, that is a potential surgical option for patients with DEE. So if
mhm,
your
mhm,
adult provider is speaking about surgery, please know that that's not just resective surgery, and that might
mhm,
be something to consider if that type
mhm.
of supplemental treatment to medication with RNS is something that you're interested in learning more about.
And you also had a few things that were kind of no-brainers for families when they are starting care with a new physician, things to look for. And then, we didn't get to it, but a lot of practical help in just navigating things. But some things like, you know, I think for Marcy and even from her perspective, it's really great to know that she has a way to contact you between visits. So when she is off and doing things, that she has contact with the office. What are some of those other things that you've either practice changing insights that you've gained from working with the EE families that have changed how you set up your office? Maybe sharing some of those because those are things families can, you don't have to love your neurologist, right? But
But you have to be
you
able
do
to
have to
access
get your
that.
meds and your insurance and your
Yes.
pharmacy, and
Yeah.
you still got to do
Yeah.
all that stuff. So
Yeah.
ways to make that easier. Yeah.
Yeah, access. So it's all access. And again, that's one of the things that I value about in private practice is I can set up that support
Hmm.
staff so that my patients always have access. So that's
Hmm.
one of the reasons I bring my physician assistants into my new patient appointments. And so that when you're contacting the office between appointments, if I'm unavailable and my physician assistant is helping you, you've met them. They've met Xuan. They understand a little bit of the history. So it's not a complete stranger who you're having to put your immediate trust in, because obviously you're contacting us usually in a time of more urgent or emergent need. We also very much stress in this office, I have a dedicated team member who does nothing but pharmacy interface. So making sure that you can access your medications, get your refills, prior authorizations, specialty pharmacies, medication spills, down the sink, making sure we can get an emergent fill. That I think alone in epilepsy
Hmm.
management should be one of your first questions between how do I access you between appointments and who do I contact to help with pharmacy interface in your office? And then in addition to that, of course, is scheduling appointments, how do I get my tests authorized? I think that is probably secondary to the
Hmm.
pharmacy being one of the more important
Hmm.
roles for epilepsy management.
Yeah, super, super helpful. I mean, I remember when, during the pharmacy conversation during the initial visit, it really like that was the second time in the visit where I thought I just saw Marcy like, oh, she was like, we have 7 meds and we need this and we need it in vials and we need a compound and I can't get the thing. And you were like, just call my office. And she was like, oh, oh, I have help. It was amazing. Yeah, it really made a difference. All right, should we open it up to the lovelies on the line today? Many of you I know, and I think Nicole might be the first time I'm meeting you. But
Karen, are you
hey,
raising
Karen.
your hand?
Yes, I am. I first want to say, can we clone you, Nicole? Because we need more doctors like you. My daughter is 28 years old, so it's been a while since we transitioned, and I'm a registered nurse. I knew the process, and it's still the one doctor we did have lined up was a neurologist, but she has probably 10 other doctors, and it took an ER visit right after her 21st birthday that we went to the pediatric hospital, and they basically during that stay begged and pleaded for doctors to take my daughter as a patient. So it shouldn't be that difficult. It's
No.
just
And I hear that. I mean, I have a patient right now who needs emergent dental surgery, and he hasn't had a primary care visit in 3 years because parents can't find a primary care doctor who accepts his insurance.
yeah.
And so it is a system-wide problem.
It is. But I love your whole concept of your office. I mean, the pharmacy that and then that they can contact you when there's, it's an amazing concept, and I really wish more doctors were like you.
Yeah. There are obviously private practice is not as
Right.
common, particularly with pediatric epilepsy compared to the
Correct.
academic institutions. There can be a good amount of support within the academic institutions. I think it's really just pinning down your practitioner and just saying, what are the avenues? And if avenue A doesn't work, what's my next option? And if that doesn't work, what's my next option? There is back staff who is helping with the prior authorizations and all the all
Right.
the forms and letters and everything. That support is there. They just tend to be a little bit more behind the scenes, not always front and center, in the and they might even not even be on the same campus. It's in some academic
Right.
institutions.
Right.
And so I wouldn't be afraid to ask for those back lines. What's your email address to your person who does your prior authorizations? This information is not readily available, but it is
No.
not under lock and key.
Right. Right.
Nicole and Heather, possibly you as well. I have a question. So, as Karen said, Nicole, you're amazing, and we wish every doctor was like you. But we have a lot of families that live in rural areas where they only have one practitioner to choose from, or you end up in the hospital in an emergency situation, and the physician who's taking care of you is the physician who's taking care of you. Do you have any advice to parents who may be in a situation, or a patient who may be in a situation where they feel the doctor isn't hearing their needs, on how to perhaps get through to them in the moment?
Yeah, yeah. I think two thoughts come to mind in that situation. First of all, one of the good things that's come out of the pandemic as far as the healthcare system is the coverage of telehealth is still persisting with most insurance companies. And so hopefully that will continue. There's actually been some really nice data from an epilepsy care standpoint to show that it's a very valid method of care, and that's been presented to the Center for Medicare Services. And so hopefully telehealth will persist, but telehealth allows you to access specialists far out of your regional area. I do consults or second opinions for families that I've met at conferences, or a friend of a friend of a friend who lives in a different state. And I might only meet with them once. And again, maybe it's just running the epilepsy history and saying, this is what we're doing. What ideas do you have? And I give them ideas to take back to their primary neurologist. I tell them anytime, if you have a primary, or if you have practitioner, period, who is offended that you sought a second opinion, then you should really look hard at whether that's the right person. No physician should have a chip on their shoulder. They should welcome any input, because there is not a step-by-step guideline on how we support patients with DEE. There is a large experience-based practice. And there are some physicians who, again, just have more experience in this space. The second thought that came to mind, Danielle, is when our patients get admitted, and this even happens to my patients, obviously, you call 911, they take you to the hospital that's on the routing sheet for the paramedics. You don't always get to go to your home hospital where your primary neurologist is at. Don't be afraid to still contact your primary neurologist. So you might be in an emergency room or admitted at another hospital or on vacation out of state, and you've had an unfortunate, seizure that's landed you in the hospital. Still call us. I still tell my families, call me no matter where you are, and I will at least try to correspond with the treating physician there. Again, I wish doctors would be more proactive in reaching out to their primary neurologist, but that practice just takes time, and that isn't always done.
I mean, you mentioned the other day, Nicole, that you like to hear it's helpful for you. It's helpful for you, not that you like it, but that it's helpful for you to know between visits that seizures are happening or not happening. Talk a little bit about that and why.
Yeah, we are here to help. As cliche as it sounds, we want to see our patients do well. We are here to help. And so if I haven't heard but from my families between visits and I walk in, I expect that the news is good. I say no news, good news. If I walk in and it's like, oh, we've had a heck of a month with X many seizures, or so and so, such and such doctor made this change, and we had pneumonia and we were in the ICU, and I don't know about any of that. It not only am I saddened by that, but also it doesn't give me a chance as a physician to think. And, I have to think a little bit more quickly, with possibly without taking into account all the details on what I want to do next. Whereas if I can look back at our phone calls or emails and I can really formulate a plan as I'm going in, it allows me to be more thoughtful.
Do we have any other questions from our community members on the call? So I think we've been at this for a little over an hour, and this was such a great conversation. Heather, did you have any final thoughts that you want to wrap up with?
No, I think thank you so much for this conversation.
Yeah.
It really, I think it's a different kind of conversation with the folks that we need to have having it. I learned some things about the pressures. I spent a lot of time talking to Marcy and with families and advocacy, but I learned some things today, Nicole, about the pressures on physicians from the system. And I hope that this has been, potentially a practice changing conversation for everyone, and for families as well. We talk about medical practice. We are practicing, right? All of these visits. So hopefully there's a little something that you can take with you and, just keep working on, unless you've got it all figured out. Um, in which case you're up next. And then just thank you everybody. Thank you, Marcy. And Marcy, this is a step in advocacy for you. This is kind of new, really getting up and using your voice. And Xuan really showed up today. We weren't sure, you're never sure how she was going to be feeling on the day. So we had some backup, but she was ready to talk today. So thank you, Xuan. And I saw there was a note to Xuan in the chat. Thank you, Xuan. Thanks for being our SCN8A kiddo's voice. That was really fantastic. And thank you all for showing up. I would love to hear from you. Stay in touch. I'm curious to hear what stood out about this conversation for you, what other conversations we should be having, and who should be at those tables. So how do we support telehealth and the persistence of those laws? How do we promote shared decision making? How do we train physicians? How do we have these conversations earlier so that, we're fortunate, Nicole, that you have had a career of this, and we didn't get to talk about it today, but you've learned some lessons along the way. I'm sure you weren't always this awesome. Right? You've learned
Learn something
to
new every
listen
day.
to
Yes.
you've learned to listen to families, right? And I think this is what it is in Rare, right? We're always learning and always creating these relationships. And so thanks everybody. Thanks for joining today. And that's it from me. Thank you so much, Danielle, for stepping up. And it was a pleasure to work with you putting this together.
Yeah, thank you so much, Heather, for putting this together for us today. And again, thank you to Marcy, and thank you to Xuan, and thank you, Dr. Cobo. We're so happy that the three of you could join us and kind of share a little bit about building your relationship. And I think we've all gotten some takeaways today that we can bring to future appointments with our providers. So I really appreciate all three of you sharing. I also this will be posted in a few weeks. I can also share Heather's email address if you're open to that, and you want to reach out to Heather directly as an advocate, as if you have ideas for future discussions, she'd love to connect with you. And finally, we'll say once again, thank you to our sponsors, Praxis and Neurocrine. And I also want to add that the Cute Syndrome Foundation is always at Epilepsy Day at Disneyland at the Expo. So if you heard about that event and you're interested in coming, Liz Ramirez, who's on our executive committee, is usually there at our table. So please come say hi. And we also are hoping to have a webinar later this year about VNS and RNS and other epilepsy surgery options. So if that piqued your interest when Dr. Cobo was speaking about that, that's something we're hoping to talk a little bit more about later this year. So thanks again to everybody for being on this call this evening or this afternoon, wherever you may be. And this concludes our Meaningful Change series for this year, but we will be back with additional webinars this fall. All right, take care, everyone. Thanks for coming.
Hey, take care, everybody. Thank you.
Bye.
Bye. Bye, Swami. Bye, Marcy.